Welcome back to Madison County Live. We have the Madison County Health Department's Director of Nursing, Ava Wright, here. Welcome, Ava.
Thank you. It's good to be back.
So you're going to talk a little bit about today, the importance of the booster, and of course, encouraging everyone to go ahead, start that process of getting your vaccine.
That's right. I know there's been a lot of information that's been passed out in the last week or so about the need for a booster vaccine or a third dose, which I will discuss a little bit about the difference in those two. And so I thought it would be good to just speak a little bit about what that means and clarify some of those things for the county so everyone has a better understanding.
Okay. All right, ma'am. It's all yours.
All right. So initially, CDC and the ACIP came out with the third dose for the mRNA vaccine guidance. And the third dose is just for the mRNA, which includes Pfizer and Moderna. So the two mRNA vaccines that are available. And that third dose, in order to receive that, it's recommended that it should be given at least 4 weeks or 28 days after that, completing that primary series. But it is limited, and it's called a third dose for a reason. It's limited to those who are immunocompromised, and CDC and ACIP recommend that third dose because of that possibility that after the primary series, that the level of protection may not be as high because of their immune status. And so this is part of that series for this group. And that group would include those that may be receiving treatment for cancer, people who may be taking any type of immunosuppressive therapy if they've had an organ transplant, untreated or advanced infections that may decrease your immune system capability, and even those that are on high-dose corticosteroids, such as someone with rheumatoid arthritis, and take those biweekly or weekly injections.
Okay, got you. So let's scenario say I'm in that category and I had my first vaccine back in March. I should get the booster.
Well, it's not a booster.
Or not a booster.
It's a third dose.
Third dose, got you. Okay,
that's
good.
So confusing, but
I know. I'm glad you're here to explain that because that's what we hear a lot is the booster.
Yes.
Ava, can you tell our audience the difference in that? Can you speak a little bit more to that really important information right there?
Okay. So as regarding the third dose, let's think a little bit about our childhood vaccines.
Right.
When we go in and start our primary series, really of any vaccine, it's usually based on the recommendation from CDC and the ACIP. It's recommended, so many doses before you're actually considered immune.
Sure.
And so a baby goes in for 2 months, 4 months, 6 months, and that's just part of the recommendation to provide that initial immunity. So with those that are immunocompromised, they need an additional dose in order to show that that vaccine is actually providing that initial immunity.
Okay, got you.
And so for those of us that are healthy and are not immunocompromised, it is recommended to have 2 doses if you're doing the mRNA. But for those that have an immune system that's having a little more difficulty creating that immunity to the disease, then now a third dose is recommended. And so some studies have shown a reduced immune response to COVID-19 vaccines in those people that have those conditions. They need the third dose in order to say they are immune or have that immunity. There's no guarantee based on all of us that we're 100% immune, but because of the studies, they have made the recommendation that if you fall into those categories, you actually need 3 doses.
Okay. All right. And those third doses are available at the Madison County Health Department. Where else can you get those as well?
Well, to clarify, here at our health department, we are providing the Moderna vaccine, which is one of the two mRNAs.
Okay.
And then the Pfizer vaccine is the other vaccine, and it is available at pharmacies and
Okay.
primary care providers through vaccinefinder.org.
Okay.
So you can search for it online, or I'm happy for you to call the health department, and
Sure.
we can help you find the Pfizer vaccine if you need that third dose.
Excellent. Fantastic. And of course, it is flu season. Do you want to elaborate a little bit on how important it is to get that flu shot too?
Yes. Just because we're in this pandemic doesn't mean that flu isn't going to come around and cause some problems for us as well. And so, just as we do every year, we recommend that you receive your flu vaccine and influenza, and it can be given with the COVID vaccine. So don't delay your COVID or your flu if you haven't
Okay.
started either one. They can be given together,
Okay.
2 different injections.
Sure.
And so that is not a deterrent if you haven't had either one. We
Right.
recommend
Gotcha.
that you go ahead and get both.
Right.
Flu vaccines are available through, again, most pharmacies and PCPs or primary care providers. So ask your doctor when you go in for your checkup, or again, call us and we can help you find a flu vaccine site so that you'll be able to go in and get your flu shot.
Excellent. That's fantastic information. I know that Madison County Health Department is a great clearinghouse. For more information, the website, phone number, Ava, what should people do?
Yes, website is Madison County Health Department, dept.org, or you can call us at 859-623-7312. Also wanted to clarify about the booster recommendation as well, if we have a minute.
Sure. Oh, absolutely.
Okay.
Go ahead.
All right, great. And so, Colleen, you asked a really good question about the difference in the booster and the third dose. So we talked about the third dose recommendation, but with the booster recommendation, that information just came out about a week ago. And I wanted to clarify that with the booster dose, that is similar to, for those of us that have developed that immunity, that initial immunity, we didn't have a low immune system or recommendation for that third dose.
Right.
Pfizer is now offering the booster dose. If you've completed your primary series within 6 months,
Okay.
only Pfizer. Moderna is still in its forthcoming information,
Sure.
guidance for Moderna or the J&J. But if you've had Pfizer and you're 65 years or older, if you live in a long-term care residential facility, or if you're 18 and older and have underlying medical conditions, including asthma, diabetes, or obesity, and for healthcare workers, teachers, any high-risk settings, grocery store, businesses, restaurants, they may also be eligible for that
Okay.
booster dose. And
Right.
that's different. That's kind of like when you get your initial tetanus series when you're a child,
Yeah.
and then every
Right.
10 years we recommend that booster. That's kind of how you look at the booster dose. It's just
Okay.
boosting the immunity that's already there.
Got you.
So
Excellent.
if you have any more questions about that, feel free to call us about the booster dose as
Okay.
well. Again, we do not offer Pfizer, but it is available through vaccinefinder.org.
Okay. Fantastic info.
Ava, as always, thank you so much for this important information. You do such a wonderful job in explaining these things so we can make the most informed decisions. We appreciate your service to our community.
Absolutely.
Well, thank you. And please, anyone, feel free to call me if you have additional questions.
Thank you, Ava.
Absolutely.
Thank you.
Our thanks to the Madison County Health Department. Always wonderful to have you here. Folks, we'll be right back.